get started, so please take your seats. All right. So anyways, thank you all so much for coming. My name is Priscilla Shu. I'm the Chief of Cardiology here at UCLA. So for those of you who haven't met me, I am so honored to be here today to celebrate the life and legacy of Dr. Jonathan Tobis. Although he and I had not overlapped for a long time, he made a huge impact on me already. He spent a long time in my office, and even in that short period of time, I could see how much he loved UCLA. He loved interventional cardiology. His impact was obvious even at that time. And even when I go across the country, there's so many faculty from around the world who speak so fondly of him and all of his achievements. So what he did had far-reaching impact. And so I'm really honored to be here today. Our program is shown here. We're going to have brief words from individuals, and then we will have an open mic if time permits, and then we'll follow by a champagne toast in the lobby. So thank you all. So with that, I'd like to introduce his son, Dr. Scott Tobis, and also his wife, Dr. Nancy Grieve, who will provide some words. Thank you.
Thank you so much, Dr. Shu. And on behalf of the Tobis family, I would like to extend a sincere thank you to UCLA for remembering and celebrating my father in such a magnificent way. We greatly appreciate the Division of Cardiology for honoring him. And special thanks to Lindsay Walton in the Development Office for organizing this event. And we would also like to extend our most sincere thanks and sincere gratitude to Mr. Anant and Ms. Eileen Yardy, who so generously was supportive of my father's research efforts and has ensured that his legacy of discovery will live on here at UCLA. And finally, we would like to thank all of you, his colleagues, not only for being here today, but also for helping to make my father's career so fulfilling. He truly loved collaborating with all of you, and he was honored to be working every day with such brilliant, caring physicians. As we will certainly hear today about his many professional accomplishments, I would like to give the perspective on what it was like to have Dr. Jonathan Tobis as a father. When I hear about all that he accomplished professionally as a physician, in the cath lab, as a researcher, and as a teacher, I have to wonder how he had time for any of that. Because to me, he seemed like a professional father. He always made my mom, my brother, and myself feel that we came first. He spent countless hours teaching us to read, ski, play tennis, baseball, chess, and essentially anything else he could think of that was fun. He would finish a long work week, pick us up at 7 p.m. on a Friday, and drive us 6 hours to Mammoth for the weekend. He took us on backpacking trips in the summer to teach us to love the outdoors and learn about astronomy at night. My brother and I always felt that we were so lucky to have such an incredible dad, and as I became a physician and a father myself, I came to truly appreciate how remarkable it was that he could be such a great father while achieving so much professionally. He was also a phenomenal grandfather to my own kids, whom he adored. And every day I strive to live up to his standard as a father and to make my daughter's childhood as happy as mine was. And there's no question that my dad was a major factor in my own decision to go into medicine as well as to become a surgeon. Going to medical school was like learning this whole new language that I can now speak to my dad in. And shadowing in the cath lab when I was young was one of those formative moments where I said, oh yeah, I want to do this. And as I finished training, it was really special to be able to talk to him about patient cases, whether they were his patients or mine. And even though we practiced about 90 miles apart from each other, there are a few patients whom we shared in common. Seeing a new patient consult where the referring physician was Dr. Jonathan Tobis always gave me a sense of pride. And it really is such a blessing as I continue to see these patients, as it makes me feel connected to him and that he is still with us, which of course in a sense he is. I think everyone in this room understands what I mean when I say that my father truly had a zest for life. He was really a joyful person, always out to have fun. Some of you may remember, there were discussions about this earlier, the James Brown doll that he put in the cath lab that would sing, "I feel good," whenever he completed a tough case. He was extremely quick-witted, and there was always another laugh around the corner. I think it was this infectious humor and positivity that touched us all. And although a few of us were privileged to actually be related to him, I believe that the true magic of John Tobis is that he made everyone around him feel like family. Thank you.
Well, thank you, and I'd also like to add my thanks to all of you for coming and to UCLA for arranging this event. I thought what I would do is just to give you two little vignettes of John rather than a series of adjectives that describe him. So for the first one, it's important to understand that I'm from New England and I have a thrifty background. So when we bought our retirement house in Santa Barbara, I bought most of the furniture from Salvation Army. And it's also important to understand that when I would see something that I thought was ugly, rather than say, "Well, that's awful," I'd say, "You know what? Those people need a consultant." So, Christmas Day, one day I opened a little package, and inside is this. Which just demonstrates his creativity and his sense of humor. The other little vignette I'd like to tell you is that we had a very good friend whose health was failing and who was getting ready to retire. He asked him, "Well, what would you like to do after retirement?" And he said, "I'd like to go fishing." Well, I was imagining he's going off the Seal Beach Pier or somewhere. No. John picks up the phone, and the next thing you know, he's arranged a fishing trip up in Puget Sound to go salmon fishing. So we do that, and a whole host of this friend's family also decided to come along. So it turned out to be a wonderful reunion for this gentleman and his family. So next slide shows how happy they both were, they accomplished their fishing trip. And finally, I'd like to say, when you lose a spouse and you have their ring, what do you do with it? And I said, I'd like to carry John with me forever. So this is what I did. And that's his ring, enlarged. I took this example after my sister, who's sitting right here, who's going to be 90 years old tomorrow. Stand up. And she tells me she played her best game of tennis yesterday. Anyway, I always loved ladybugs, so that's the ladybug in the middle, and all my earrings, and around it is John's wedding ring now, that's been enlarged. So I can wear it forever. Thank you again.
Thank you. So I'm Linda Deemer, and I'm currently the Vice Chair of Medicine. And I had the great honor of being the Chief of honors in my life that John asked me to present at this event. The second greatest honor I'll mention at the end. As you know, John was larger than life, and his life was pointer. Oh, thank you. His life was a fantastic voyage. As Nancy suggested, I'll share the story of his recruitment to UCLA and how over time my family and I were drawn into his family life. In the early 1990s, John was doing groundbreaking work on balloon angioplasty and intravascular ultrasound, IVUS. It just happens that at that same time I was doing research on exactly the same fields and collaborating with the same industry scientists that he was. We even both published solo author papers in 1991 in circulation at the same time. But his article had a wonderful subtitle called A Fantastic Voyage. We first met when the IVUS industry scientist told me to go hear a talk by a great IVUS investigator who was speaking in the LA area. And as you can imagine, it was an amazing talk. Great insight, great enthusiasm, innovation, and humor. And I thought, we need him here at UCLA. How can we do that? Well, fortunately at the time, I was the chief of cardiology. And one day the director of invasive cardiology, Larry Yeatman, told me, came and said, I want to bring this amazing interventionalist from UC Irvine, Dr. Jonathan Tobis. So I smiled and I said, wonderful. Please proceed and let me know if you need anything. And he was surprised and said, he asked, don't you need to interview him? I said, not at all. And that was the recruitment of Jonathan Tobis to UC Irvine. At UCLA, of course, John rose to international acclaim, and he was also a dedicated and beloved mentor. What I never expected was that I'd end up drawn into John's world with his family outside of work. It turned out he was a mountain man, an expert hiker, expert skier, an amazing backpacker. He was also a leader and drew friends with him on all of his adventures. As you know, he pioneered research on patent foraminovaly and acute altitude sickness, doing research up here at Whitney Portal. I may even have inspired some of that work since I got severe altitude sickness and was throwing up my guts on high altitude backpacks with his group. Now, John, he knew how to laugh at adversity. Even COVID didn't get him down. And when a friend gave him a gift of a beehive, he became an expert beekeeper. John also knew his way around the kitchen, and who knows, well, he was a great host, but he also knew that in the kitchen he could party and dance. And maybe he even did that in the cath lab too. His personality was not just magnetic, it was more like the Venturi effect. Just as fluid moving through a narrow chamber draws in and entrains air like a wine aerator, John's powerful energy drew others into the direction of his movement. Here are just a few of the people who have been swept up into his flow, and here are some more. We are all fans. Eventually, John did have to stay home, but even then, he continued seeing patients virtually. 20 years ago, 2006, John wrote, "The environment of academic medicine and clinical research continues to provide excitement and drive in my life. I'm always stimulated by the teaching environment and working with cardiology fellows and residents on research projects and in clinical care. I plan to continue to work in the cardiac catheterization laboratory for as long as I'm physically able." And that's exactly what he did. Now, in his lab, some of you may be able to see that he had a telehealth mascot. His rescue dog that he and his granddaughters, appropriately named Sierra. So I mentioned earlier that there was a second great honor, and it is this. In his last days, John asked me, and my better half Dave, to adopt Sierra. And here she is, in the mountains, like John. She has a zest for life and through the thrill of adventure, exploring the mountains and loving every trail she takes. She's a strong and enthusiastic mountain dog, and she'd make him proud. Sometimes, when she watches the sunset over the ocean, I'm sure she's thinking about him. His life truly was a fantastic voyage.
So, it's my pleasure and honor to be here speaking about Jonathan Tobis, Dr. Tobis. And I was a little surprised when he said, "Will you speak?" And my interactions with John were sort of detailed, and I'll give you a handful of examples. And I neglected to ask him, "What would you like me to say?" And so I'm on my own. But here is I'll share with you a few interactions with John, and the reason that I think all of us admire him. My first interaction was in 2003. As a heart patient, I had some complications, and unlike most physicians, as I was waiting in the waiting room, he comes down. I'm used to people escorting me to the physician's or the head of cardiology's office. He comes down. He strikes up a conversation, and it's about everything other than my ailment. And it was more about, do you enjoy ghee? And for those of you who don't know what ghee is something special in the Indian cuisine. And I said, of course I do. Do you like fried vegetables? And I said, of course I do. Well, you're paying a price for it. And I said, oh, okay. As we walked to his office, he turns to me and says, there are people waiting at the elevator. Are you okay walking up? And I said, sure, I'm okay walking up. And so we walk up to his office on the 3rd floor. And unbeknownst to me, he's speaking with me and going through an examination, which I didn't realize. And as we got to the top, he calmly says to me, I think you're okay, but whenever you're ready for this procedure, let me know and we'll organize it. Now, as an engineer, I like to find out what exactly people are doing to me. And most folks, unlike John, are not eager to talk about exactly what's going on. And so he said, my thinking is I'm going to put a stent inside a stent, and then we're going to do brachytherapy. And I said, oh, and this is 2003, so there was no AI at that point in time. And I had to do my Google research. And I said to him, so what's the likelihood of success? And he said, 70%, maybe. And I said, for both? And he said, more than likely. So I said to him, I'm sort of an unlucky guy when it comes to procedures. How would you feel about doing one of them first, and if I get unlucky, do the second? Now, this kind of a conversation I would have with John, and it would be just delightful. He sort of enjoyed it, I enjoyed it. Anyways, we agreed, and then on the day of surgery, I say to him, so, are you going to put me on general or local? And his response is, depends on how many questions you ask. So the first time, it was general anesthesia. And that's the way it was. The second time, it was local. And there was a conversation that was going on as this procedure was taking place. And without getting into the details of the conversation, I really appreciated the fact that this was possible. The last story that I'd like to share with you is, many of you would know that he was an atheist. And he was asked to speak at a cardiologist conference in San Diego. And they asked him if he would speak about dying and death. And I asked, can you show me the recorded presentation? And he did. The thing that surprised me was his sense of humor as all of this is going on. And he talked about the request from the cardiology conference organizers about talking about dying rather than what cardiologists like to talk about. He opens his statement by making the statement. He said, I was perplexed. I wasn't sure if I should say yes, and what would I say in terms of dying and death? And he starts the conversation by saying, and because I thought that I would not be alive when the conference occurred, I felt it was safe for me to accept this invitation. And I would say to all of you, he was so special in terms of his commitment to his profession, his commitment to patient care, his capacity to talk through things with an open mind. And I wasn't privy to the fact that he was in fact a celebrity in his field in terms of things such as IVUS and PFO and the other things that he worked on. And so it was really my privilege. And I used to really enjoy our dinners with Nancy and John, and I shall miss him. And let me say, in spite of the fact that he may have questioned religion and God, to me, his traits, his habits, his behavior was more godly than most people that I have run into. Thank you, John, for everything that you have done. We miss you, and we're so glad you're such a
Hi, I'm Andy Charles. I'm a neurologist here at UCLA, and I'm director of what's called the UCLA Goldberg Migraine Program. You may be wondering why a migraine neurologist is here speaking today, and so I'm about to tell you. So I first started interacting with John, I think it was around 2010, and he started bugging me about this idea that patent foramen ovale is involved in migraine. And for those of you who don't know, patent foramen ovale is a flap in the heart that many of us have, and when it's big enough, blood can cross from the right side of the circulation to the left, and sometimes bring along bad things with it, like blood clots that can cause stroke, but also potentially substances that could cause migraine. And so John was talking to me about this a lot, and eventually he got a clinical trial going for closure of PFO for patients with migraine. And so he asked me if I wanted to be involved with this. And my first response was no. Actually, I think it was hell no. But John actually didn't like to take no for an answer. And so he kept calling me like every week, or showing up at my office with that sort of cherubic smile. And how could you refuse? It was just the persistence and the cajoling and the taunting, frankly, finally made me give in. And it was great. It was a very tough trial to do. There's someone in the room who've been involved with this. A lot of knows how difficult it was. But it was a great study, and the outcome wasn't exactly what he had hoped for, but it taught us an awful lot about the relationship between patent preimmunology and migraine, and frankly just completely changed my understanding of this process. And while I'll say, sorry John, I don't want to close the PFO of all migraine patients, I've now come to the view that the stroke risk associated with migraine is almost completely due to patent preimmunology, and that's all because of John. And so really just changed the way we think about things in ways that were very surprising to me. So the other things that I would just say is that he was a great colleague and a wonderful teacher, and interacted with others in our group. We have a large group of neurologists who take care of migraine, and he was always willing to speak with them and share his understanding and his expertise. And that was something that everyone in our group was grateful for. He was also just really a consummate clinician in every way. So obviously you've heard about all these sort of technical skills, but when you sent patients to him, you could always do so with the confidence that he would just that they would come away being glad that they saw him. And so that's something that I also learned from him is how, when people are facing difficult situations, to assuage their fears, to be confident but not overconfident. And so that was another thing that I really got from my interactions with him. And so, it's funny, I was sort of thinking about why he would ask me to speak. And I think it's probably because he knew that I would have to admit that he was right. So, which is a hard thing to do, but it is true that he had this way of just sort of deflating arrogance, and it's something where I've understood that I had been fixed in my ideas in ways that he really helped with. So it was an absolute privilege to work with him, and I'm pleased to say that we're going to be carrying on the legacy of the work with PFO and migraine. And again, I really feel grateful for the opportunity to have worked with him and now to carry on the work that he began. Thanks.
It's wonderful that UCLA is recognizing John Tobis for the history-making changes that he helped to develop in cardiology and in catheterization and the healing of people's physical hearts. My wonderful brother David and I are speaking from our personal and family connection about John as he touched our emotional hearts and those of so many others. John himself had one of the most generous hearts and loving natures, driven by values that were committed to making this a better world in his profession, in personal relationships, and in social commitments. In his social commitment, he began his career working with local groups in underserved Black and Brown communities to ensure that a community voice in healthcare and so many hospitals reflect that concern and respond to the needs of the people who need the care. He supported many social issues like civil rights, a government that would serve its people, and an end to wars of choice. He was outraged by a right wing spreading misinformation. This is a reason he became such a dedicated man of science, to be sure that our best treatment was based on tested fact and not some abstract faith or ideological test. On a personal level, He was a joy, funny and caring. He so often brought people together as he does today, often with delicious food, often with too much food, with humor. In our family, there's a famous story. We remember him putting on a little performance with underpants on his head, and all of us were just laughing as he danced around. He had enormous good spirit and goodwill. So many loved John because he brought so much love and so much heart to all he did. And with our hearts broken with his passing, we honor him by living the values he held with love at the center to make this a more just, caring, and truly healthy world.
The announcement of today's event invited us to a gathering, quote, to honor a brilliant mind, a compassionate heart, and a life devoted to advancing medical science. My brother was born into a family that nurtured both his mind and his heart. Our family provided the love and security and resources he needed for his brilliance to blossom. When he had trouble reading in elementary school, our mother sat with him week after week, teaching him to read. How many other brilliant Jonathan Tobises might there be with families and societies that nurture their yet unblossomed brilliance? My brother had a compassionate heart. As we all know, he helped thousands of patients with their cardiac problems. He helped countless families and friends of friends who had medical concerns. He took under his wing and his roof people he mentored and people whose lives he enriched. Out of passion and compassion, he sold his Tesla because of Elon Musk's attacks on democracy. The honoring of John comes at a time when vaccines and science and truth and justice, the rule of law and democracy are under attack by a president who suggested injecting Clorox into our veins to fight COVID. John loved science and he loved our democracy. We are honoring him at a time when institutions like UCLA are pressured to abandon science and diversity to comply with the wishes of a tyrant. The invitation to today's event ended with a quote from Ronald Reagan. Quote, "Wherever a beautiful soul has been, there is a trail of beautiful memories." Although John did not believe in the soul, his essence was beautiful. John used his brilliant mind and his compassionate heart to help others advance medical science and to promote truth. May we be all inspired by him to stand up for truth, democracy, and science. Thank you very much.
Hello, I'm Dr. Jeffrey Saber. I'm another neurologist, which shows you the wide breadth of John's interest across multiple organs, heart and brain. He was a philosopher and a neuroscientist in addition to a cardiologist. And I am a stroke neurologist, and I'll tell you an aspect of my first meeting John that I never understood until just a few moments ago when Linda spoke. Because I first met John a little over 20 years ago when somebody, as head of the stroke program here at UCLA, somebody came up to me and said, you know, there's this cardiologist giving a talk on stroke in the Department of Medicine, and he had a stroke, and I said, that's maybe neurologist would be part of the recruitment evaluation or something. But I said, okay, all right, we'll see. Then 2 months later, somebody else came up to me and said, you know, that cardiologist has started his own transcranial Doppler ultrasound laboratory. And I was director of the UCLA transcranial. I said, you know, I think I need to meet this guy. And I put on, I'm used to dealing with neurosurgeons. I put on my battle armor. I went to meet John, ready to say, what the heck are you doing? And he was so engaging and disarming and open, and it made me seem like it's completely natural that he's doing all that. And now I know, Linda, why I was not involved in the recruitment. It was such an easy decision. That began a collaboration of over 20 years about preventing stroke, closing this opening in the upper chamber of the heart that 1/4 of people have, patent from the valley. And John played an essential role in my entry into that field, because shortly after we first started collaborating, I was approached by the leading stroke neurologists that they were launching a multi-center trial of a device to close these openings, and the UCLA liked to be one of the 30 centers. And I said, yes, of course, very interested. Let me speak to our interventional cardiologist who specializes in that, and I'm sure we'll be joining. Talked to John, he said, I don't like that device. We're not going in. And I thought, okay, well, he's the interventional cardiologist. I guess he knows. And so that trial started, and then about a year later, another company came along with another device, and they wanted to start a trial, and there were no stroke neurologists left in the field who were not part of the first trial, who could help run the second trial. So they had to go all the way down in seniority to me. And I got to be one of the 4 members of the steering committee for the RESPECT trial. And John was absolutely right, that first trial failed, in part because the device didn't work. And when it failed, everyone thought, this treatment doesn't work. And then the trial using the device that he supported succeeded, and this became an established treatment for this cause of 1 in 20 of all strokes is now treatable because of John Tobis. Because of him, we were able together to develop the Pascal algorithm, which is now used worldwide to choose which patients to close this opening and keep any approach from happening. So I thought to myself that John closed holes in the heart to preserve the brain and mind and saved many lives while he was alive, and because of the durability of his research, to save countless lives in the years ahead. I thought I'd close with 2 quotes from William Osler, the founder of modern American medicine, the great clinician, clinical scientist, and there's no higher compliment one can give than to say someone is an Oslerian physician. And I've never almost said that about anyone. John truly is in that mold of compassion, patient, deep understanding of disease, deep engagement with individuals. Osler said, the good physician treats the disease, the great physician treats the patient who has the disease. And I referred many patients to John. Not one ever came back saying that, I mean, there are great physicians here. I refer to great physicians all the time. Everybody upsets somebody, not John. Everyone loved him as a patient. And then at the end of his life, John, through the illness that took him, remained engaged right up into the last moment. Just a few days before he passed, he participated, that he insisted keep on happening. He was sharp and on top of things, and God knows everything else that you have to be worried about. Osler also said, courage and cheerfulness will not only carry you through the rough places in life, but will enable you to bring comfort and help to the weak-hearted, and will console you in the sad hours. John, your courage and cheerfulness helped you help so many patients, and I will carry it with me and try to bring it forward forever. Thank you.
Wow, this has been terrific. Wow, so many of his colleagues that I'm learning from. John called me, I think, 2 days before he died, and asked me if I would speak today about his research, and which I thought was just pretty amazing that he's organizing his memorial himself. You know, I'll give you my thoughts here. So I think you all know that he played a huge role at UCLA and UCLA, taking care of patients, training fellows, a lot of teaching. But the part that I got to know him through was his groundbreaking research. So there were really 3 major contributions. First was before I knew him in the early 80s, where he was the first to use digital angiography. So we used to, for many years, when we did an angiogram on a patient, we had to develop it. The developer, you know, like you probably did in high school, like the fluoride and fixation and all that. And then we had a celluloid. It was like the Hollywood movie we'd watch, which was very limiting because, you know, you couldn't enlarge it. You couldn't just share it over the internet like we do now. And the resolution wasn't as good. So John was really the first person to be using this, and it became kind of the complete standard, you know, of how we treat patients. So that was in the 80s. Then in the 90s, his thing was intravascular ultrasound. So he was in the ground floor of this really important technology that is still today not just being used, but being like developed more. It's become an integral part of the guidelines. And the idea is that instead of just having an angiogram, like I showed you on the last slide, you put this thing down the artery, and it gives you, it looks like histological sections, like you've got the artery sliced on a microscope. And you can see calcium, you can see the anatomy, the blockages. And then when we put stents in, the big thing was figuring out that we thought these stents were doing a good job, but not until we did intravascular ultrasound did we realize that we really need to press them in, make them bigger, and get them pressed into the walls and open that artery wide. And with all kinds of algorithms to decide how to do this. And this has become the gold standard, a huge thing. And he actually got a Lifetime Achievement Award a couple of years ago by our major society, our Cath Lab Society, along with Antonio. Antonio and he worked together in Milan and spent a lot of time with Antonio. Was another force in our field. And this is a big award. It's the Mason Sones Award. Mason Sones invented coronary angiography in the Cleveland Clinic, you know, in the 60s. So it's a big deal. That is really groundbreaking research. And then we've had 2 neurologists already talk about this. So this is just a picture of what a PFO looks like. And what John would talk about is the Tobis triad. So a little alliteration there. You know, patient with chest pain or a coronary spasm, but no blockages, and patent foraminal valley and a migraine. And this idea is that these evil humors and thrombogenic factors cross through this PFO and cause migraine headaches along with some chest pain and strokes. So big deal. This is still a work in progress. We're still working out the bugs in this. And John kind of wants us to carry this on, which we're all doing. But he did a lot of research. And if you look at his CV, it's hundreds of papers. I just came across this one that I got to do with him, where he was at UCLA with lots of heart transplant patients who needed stents, and then I was doing brachytherapy, which I think Dr. Yardy mentioned already. And so we collaborated on this. Just one example of really hundreds of papers. And then, you know, if you're a luminary like John Tobis, you write textbooks. So he has a textbook on ultrasound imaging, a textbook on garner stenting, and a textbook also on VFO closure. So really, huge contributions to our field. Now, I got to know him through this groundbreaking research because it was a thing we called the speaking circuit back in the 90s. And it was an amazing time. He was everywhere. Japan, Rome, Washington, Singapore, China, always on the airplane. And what happened is we developed this great camaraderie. And we'd be in Korea doing live cases and go to a big hall of 10,000 people, and you'd be all mic'd up. Yeah, and I'd be asking our hosts about what's going on in North Korea, and do you have any family there? And they'd say, we don't talk about North Korea at live demonstration. It was amazing, and so John had this, of course, this youthful, energy that he would just really spread around the world. And then the thing about John, it was so special. This is a picture of Antonio and John from the 90s, and the reason I connected with him was that we had these one-on-one conversations. He was really about having a conversation. So we'd be at this symposium and some reception, and we'd find a corner and then have a real conversation about something that wasn't just all fluff. And he'd like to talk about what was really real in his life. And then I got onto the family annual letter that would come out in the holiday, and where that letter was a total honest letter. I mean, just you saw the good stuff, and you saw that like all families, there's rough edges, and you got to hear all that, and that was to me very, very special about John. So this was 2 years ago. We do a conference in San Diego every fall, and invite him down. He's come down many times to talk about PFO, but we also have like this tradition we've developed just in recent years where we talk about emotional things. Someone talked about his alcoholism once. We've had a lot of interesting talks. And I said, hey, John, maybe you want to talk about this illness you have? And I wasn't surprised that he said yes. So he came down and talked to us. And so this is, fortunately, this time I had learned to videotape these emotional sessions. And so this is on YouTube. And he gave just a wonderful, wonderful talk that you can all look at. And he talked about his illness, he talked about his career. He provided pearls like, don't talk to your patients about your own disease, especially cancer diagnosis. He says that just turns into everyone crying, and it doesn't help the patient. He personalized the physical pain of cancer. He called it death by 1,000 cuts. So, you really could feel just what it's like to be a patient, having to go to scan after scan, poke after poke, and feeling crummy for the treatments. I mean, it's a rough thing to go through. As mentioned earlier, I mean, he was out there about skepticism about God. I asked him, hey, everyone says there's no atheists in the foxhole, but John stuck to it, and he said, no, I don't think there was an afterlife. He's very honest in this 25-minute or so video. Also emphasized the loneliness of dying, how he had all these friends and family, but you still die alone. Something that I really had to wrap my head around this. I still haven't really understood that, but I believe it's probably true. And he also, especially at the end, he encouraged us, the docs, to be proud of what we do. It's a big job, so we should be proud of ourselves. And lastly, it was also very funny. And John just has a great sense of humor. So the moment that's the funniest is, when this is Bill Lombardi over here, he's another luminary, asking him, if you go back 30 years, what advice would you give yourself? And John kind of looks at the sky and leans back and kind of smiles and says, more sex. It's just hysterical. And more sex, doesn't just mean more sex. I know what that means. It means more love, more connection, more human connection. That's really, the message there. And this is, so it's on YouTube. And if you want to find it, you just have to go to YouTube and put in the search bar, Jonathan Tobis, or John, J-O-N, Tobis. It's about his reflection on dying, healing, like that, and you'll find it. And I really encourage you to listen to it. It was already inspirational because the last conference, which was a year later, a month after he died, just, it was last November. Steve Romero's our imaging, structural imager. He's asked me, he said, I want to talk about, that John's talk was so inspirational. I want to get up and talk about my multiple sclerosis flare. This is a guy who's, young, 45-year-old cardiologist who runs marathons, but had a flare, stopped taking the drugs he was supposed to take, ended up in a wheelchair, and now is back at it. Inspired by John, talked a lot about John at his talk. So John has been a powerful force in a lot of us, and for me, it's just going to be the one-on-one talks, the truthful, honest talks, and the way he had that warm smile that I will surely miss, as we all. Thank you.
Good evening, everyone. I'd like to first start by thanking Lindsay, Walton, Lada for arranging a wonderful program tonight. And it's so great to have three chiefs of cardiology here, Dr. Deemer, Dr. Fonro, and Dr. Shu, the three chiefs that I've had during my career. And also Paul as well, yes, the four chiefs of cardiology. One of the disadvantages of coming a little bit later and speaking is that everyone's kind of said everything that has to be said. So I have to pretty much come here and innovate my talk. So I met John first time 28 years ago. There were three interventional cardiologists at UCLA and I was the fourth. They called themselves the Three Musketeers, and once I joined I said we were the Fab Four. Dr. Yateman, who was the senior cardiologist, he was easy to figure out. His whole mantra was trust but verify. The second cardiologist was Dr. Courier. I was here and I knew him really well. He's like a French macaron, a little hard on the outside but really soft on the inside. And I still admire his sense of fashion with his nice tie today that he's wearing. It's an inside joke. But when it came to John, it was a little difficult for me to figure him out. Because John was all over the place. I really couldn't understand who he was. The first time I talked to him, all his responses back to me were back in Italian. So for the longest time, I thought he was an Italian guy. He traveled to Italy, hang out with Antonio. So I thought he was Italian for the longest time. Then came a chance for me to do a case with him, and I'm scrubbed. John's next to me, and I'm not listening to the music because I'm kind of nervous. My first few cases at UCLA, and every few minutes, John's next to me, and then he disappears, and then he reappears, and I'm like, what's going on? And what he was doing was he was trying to do the James Brown splits. James Brown music was going on, so I thought maybe he's from the South, maybe that's his heritage. So I said, okay, this is getting a little confusing for me. Then came a Christmas party, and all of us were impeccably dressed, in all our ugly Christmas sweaters. And suddenly John comes down the stairs of his home, and he's wearing a cheetah print Speedo. And nothing else. And he's just acting normal, and everyone's like, what's going on over here? I thought maybe there's some like Eastern European fashion sense over there. And then Judith reminded me there was another party where he came dressed up in sheets, and he was like a Greek kind of fashion. So I kept on getting confused. The most troubling thing that happened was we went to this Indian restaurant, which was right across from the hospital, and John started talking to the chef about the food and how he was making the food and everything. And that was all nice. I thought I was happy that John actually liked the Indian food. The next time I went to the restaurant, and I can speak in an Indian accent. I'm allowed, but no one else is. But the chef comes to me and he says, Ravi sir, Johnny sir, where is he? And I'm like, who's Johnny sir? It's like, Johnny sir, your friend. He came to eat here where is he? He's like, I don't know, I'll invite him next time. He's like, Ravi sir, 100% sure Johnny sir is Indian. And I said, it's not possible, he's not Indian, I don't think so. I'm confused as it is, and now he's Indian. He's like, 100% Johnny sir is Indian. And I'm like, how sure are you? He's like, more than 50%. That's how Indians talk, you know, the percentages are stretched. But the last confusing time came when I was at this restaurant, and I can't recollect this really well, but all I remember, there were like 5 empty sake glasses in front of me, and maybe there were 10, maybe there were 15, and I look up through this, fog, and John's on stage, and he's singing karaoke with these Japanese people, and then he's singing a Japanese song. And I'm sitting there thinking, I'm in Japan, and I don't think I packed my passport. And I was so nervous, and then we come out of the restaurant, I'm like, John, I'm sorry, did I bring my passport? And John's like, you're such a lightweight. We are at an Armenian restaurant in Glendale. So, John was multi-ethnic before it was fashionable to say so. And that was it. And a few years later, it came as a shock that John was actually from Brooklyn and he was Jewish. And now I find out that he didn't even believe in God. It's so confusing. But he was really curious about the world. He embraced different cultures. And at UCLA, there are so many different cultures in the cath lab. And he just didn't exist in this crazy world, but he connected everybody. And he did that on every single day. He made people very comfortable, included, understood, and he was very supportive. But then I have one other story that I wanted to share, and it's not a great story from my side, but we played a tennis match. This was about a couple of years ago before John got sick. I thought I was in good shape, and I went in very confident. I'm like, I got this. John's like pushing like mid-70s. I'm in my 50s. I'm like, this is going to be easy. But what followed was like just a very efficient performance. Not dramatic, no craziness, just very precise, very measured shots, right angles, everything perfect. And he beat me 6-love, 6-love. Didn't win a single game, which is very disappointing. But that was essentially what John was. No wasted motion, no need to prove anything, especially his mastery. And that's the precision he brought to the cath lab. He just didn't react. He anticipated what was coming next. He understood, like I said, all the angles, the risks, how to prepare for what's coming next. But that was John's expertise. But in many ways, I feel John, since I could never play singles with him, I thought, well, maybe he's like the perfect doubles partner. He can carry anybody throughout any kind of difficulty, and that's what he did in the cath lab with his colleagues and everyone. That he made the entire team better. In the cath lab that's in the back, that spent countless of hours with him, they can say that. He was there to support you when you needed him the most, and his impact at UCLA is always going to be enormous. It lives in the trainees that he trained, all the colleagues that worked with him, and the patients that remember him to this day. Every time I would send a patient to him, they would call me right after they had seen John, like, oh, we love him, he's so amazing, thank you so much. But just like in a tennis game, there is always a final point, and the great players, the ones that truly change the game, their influence continues long after they're gone. And I think that I can say the same about John as well. He was truly a rare individual. He played, tennis, his career with brilliance, humility, and grace, and we miss him. And then there was one picture that was captured, and I think maybe Bart, who was in the audience, took this picture on one of our meetings in Namma. And the picture is still in my office, and right there. And it's a beautiful picture of the four of us. That you know, it says the Fab Four, but a couple of weeks ago, I changed the caption to "When We Were Kings."
Even before I identify myself, I just need to say how moved I am by everyone here. By everyone here. And I need to ask, who scheduled me to follow Ravi? My name is Denny Aftergut. Way back in the day, like this fellow right here, Frederick Barron, I was one of John's 3 college roommates, and the 4 of us remained brothers through 6 decades of the journey. When John asked me to speak here, unlike Andrew and unlike, I asked, this is a physician's man, why? You can tell them what I was like in college. Well, John, if you wanted me to tell them about your irreverent, juvenile sense of humor, I'm afraid that Paul's story has already stolen that thunder. Or sex. And if you wanted me to tell them that in college you looked like an angel, that picture over there speaks 1,000 words more than mine. The best I can do with words is to borrow from our 4th roommates, not here, the most academic of us. I've been thinking about how odd it was, Jeffrey wrote shortly after John died, that John and I became friends. He was too handsome, too full of joie de vivre, a tennis player and a skier to boot. But then again, he studied harder than anyone I ever knew. And so we had late nights in the library together. John was a worker bee all his life, and as Anat said, humble. He once lamented, wrongly, that he was the least gifted among the 4 of us. Well, John, look who has the chair at UC Medical Center now. And if you'll indulge me, and if technology permits, I want to bring John's voice into the room. These 4 little segments come from the speech that Paul described, a physician's reflection on his dying, and they encapsulate a few of the parts of John that were his essence, the essence of John, Marvin, Tobis, and me. First, as others have said, he was the truth teller. He never gilded the lily.
A year later, here I am. So what have I learned this past year? I've learned that no matter how much love you have surrounding you and support from friends and family, this is a dance we ultimately do alone.
And then John was so present in his life. He appreciated it. And if he had regrets, as Sinatra sang it, they were too few to mention.
And won the tiebreaker. That felt really good. So what else have I learned? I've learned that I don't have a bucket list. I have accomplished a great deal in my life, and I have been extremely happy with an amazing balance of hard work, incredible family, and wonderful, pleasurable experiences.
And then there was the infectious laugh. Andrew or someone referred to it. Especially at life's dark humor. In the question and answer after his speech, he described the instructions that he received for picking up the drug that he needed to end his suffering.
You know, I think about, well, you know, you go through this fantasy, I'm gonna go to the pharmacist, they have to give it to you, they have to instruct it. They say, don't take it on the premises. I'm going in for a beer. And so,
And then John, always the physician. His patients came first. And he was also, as Paul said, the giver of appreciation to other physicians who did what he did.
although some may consider that an extreme form of trade-off. It has been a wonderful experience to have spent my life as an interventional cardiologist. You should all be proud of what you do every day. Thank you.
2 days before John died, a few of us had a Zoom call with him, and he described why he had endured so long with level 10 pain. I want to keep doing my research. And so, any and all who wish to honor who John Marvin Tobis indeed was, what he wanted, please consider joining large and small, or small, the research fund here at UCLA in his name, so that his legacy outlasts him by 1,000 years. Death is a dance you do alone. Love is the only consolation.
Thank you everyone for those incredible reflections on the life of Dr. Tobis. And we do have a couple minutes left. If there's anyone in the audience would like to speak, we'd like to welcome you for a couple minutes of time. Yes, Raheem?
Good evening, everyone. Thank you for joining us to celebrate the life of Dr. John Tobis. My name is Nasim Rafiq, one of the interventional cardiologists at UCLA. I knew John Tobis for more than 11 years, maybe not as long as many of you. I was one of his fellows and then subsequently continued working with him for many years. And it was an absolute pleasure training with him and then working with him for that closely for many years. John was a legend. If you trained with him, you learned the best. He helped shape the guidelines, but he also believed they should be a little flexible, just kind of like a PFO. He had a way of seeing the connection the rest of us did not see. He loved closing PFOs, playing tennis, as many of you alluded, and he loved hiking, especially the John Muir Trail. I'm not sure what's the connection or common thing among all these three things. Perhaps the precision, persistence, and always finding a way to cross. He was deeply committed to PFO research, as several of you alluded, and I was closely involved with him on many of the projects, and working with him even in the days and the weeks before his passing. And during one of these meetings, I have to basically tell him you should be spending more time with your family and we will continue your research. So that shows the level of his commitment to the research and how much he cared about the research he was doing and also about the research team he was working with. Okay, we have the research team members here, so I'd like them to stand. So we have our research fellow, medical student training, we have been working with John for the past couple of years on many different projects, and we are continuing that research to honor the tradition of John. More importantly, he made all of us better, teaching not just the techniques, but composure, compassion, and also good judgment. He will always be remembered. Every time I do a case, I hear a voice in my ears telling me that if there is a will, there is always a way to cross. And that voice gets louder when I'm doing a complex PFO case. Thank you.
Good afternoon, everyone. It's such an honor to be here today. Honor such a great, wonderful man. Just like many of you, Dr. Tobis and I go back over some 20 years. And they say he was an atheist, but you know, you judge a tree by its fruit. Just because somebody said they're an atheist, I really don't mean it. And I say in the sense of walking in love. The Christians walk in love. This was the most loving man I ever met. So loving. He's always reaching out to put a smile on somebody's face, to pick somebody up, to let them know that they can do anything they want to do. All they needed was faith. And he had that ability to lift, motivate, and make you want to fly. I was so proud to stand beside him during such difficult cases a lot of times. I spent some 23 years at UCLA before I retired 8 years ago. I spent 38 years in cardiology before I retired. But not only so, but John also brought joy, you know? And that joy came in the value of people. John could be around somebody and make them a better person. He had that sixth sense to look inside the heart and mind and see what's a good person and what's a bad person. And oftentimes, he wasn't ashamed to say, once upon a time, we were doing a difficult case at the table. We had a fellow standing between us. I was at the end of the table down here, John was at the head. And the fellow was trying to put a wire in the catheter, something very simple. You know, you could stretch the catheter out and just spend 5 minutes trying to do it. Otherwise, you could just grab the catheter, the wire in one hand and just do like this right there and stretch it out and put it just quick. That really comes in handy in PTCA if you're working fast. But I tried to tell him how to do it. He turned around and looked at me like, who are you? Are you black or are you crazy? He had that expression on his face. The word didn't come out of his mouth, but he had that expression on his face. But when he forgot to change his facial expression when he turned around and faced John. John said, stop right here. Put the catheter down. Go, stand in the corner. You go act like a child, I'm gonna treat you like a child. That fellow there I didn't see him no more around UCLA. So much love. So much love. In conclusion, I could talk all day about John, because I love him and he loved me. I've been to his house so many times, I feel like a regular guest there. Praise God. And each patient, John wanted each patient to make, and each student, to make sure they had the best opportunity to have a richer life, a fuller life. They could grow. He stood for that. And I better cut it off right there, and I'll just say, Dr. Tobis is one of the greatest doctors I ever worked around. I've learned much from him. He learned much from me. We respect each other. We'll always love each other. Keep up the good work. God bless you all.
Good evening, everyone. Thanks for coming. My name is Kuya Bukwa. I'm one of the interventional cardiologists here, and I had the absolute privilege of having Dr. Tobis as a mentor since 2008, as a resident, as a cardiology fellow, interventional fellow, and attending. Everybody has talked about a lot of amazing attributes that he has, and I didn't know I was going to speak, so I don't have anything written. But as everybody was speaking, one thing that I wanted to emphasize is when you do your training, you're spending more time in the hospital than at home, and you're spending more time with people in the hospital than your own family. So I could say in a lot of ways, Dr. Tobis, John, was my father figure, growing up in the hospital system and through my training. Not only did he go above and beyond to teach us what he knew and pass down the knowledge, but also guidance that went above and beyond cardiology and the cath lab, and how he tried to guide you also through life. When you're resident, you're stressed out, you're applying to cardiology fellowship, and his guidance to help us through that, his humility to say, hey, I don't know what to say, because when I look at your resume, I wouldn't have gotten into this fellowship, so I don't know what else to say. So, along the way, with all his accomplishment, being so humble, and when Awesome and I later on trained with him and we're meeting in the cath lab in Santa Monica, I wanted to expand the PFO program. He was so supportive to the point that he had to proctor us, and he would drive out from Santa Barbara just to proctor us for our first initial cases. And after we would be obviously confident enough to do it, until the past few years, a few weeks before he left us, I would still call him without PFO closures, and he would still come down, not because I needed him or he needed to, because it was precious time for both of us, and we both working together. And as an interventionist, you never have lunch, and it was the only times I would have lunch. So it ended up being a ritual where on Tuesdays we do a PFO closures and make sure I move things around where we could have the Tobis lunch, and we could have lunch together. And even a few weeks before all of this happened, I was honored to have lunch with him. And again, his guidance above and beyond the cath lab of family life. I went through a lot of trauma as well, and he helped me through that and how to deal with life, everything that comes with life. So it really was an honor working with him. He was a father to me, a huge loss. I just did PFO closure before I came here, so it was really hard. And everything that he has taught us, it's gonna live in our hearts and minds forever. And I know for all of us, it's been an absolute honor to work with him. And more importantly, we're gonna do everything to make him proud and make his legacy live.
Thank you all. So I think wonderful speeches, really Dr. Dave will lead us on that. So thank you all so much for